UTTV. The continuing concerns about health insurance. I don't know, it takes up so much of our time in these shows, the radio show, all over the place, because Obamacare has thrown everything into chaos as we approach the January 1 deadline, with tons of people not having coverage, other people wondering what coverage they do have. We just had the story about the Vista people working in a domestic Peace Corps for the federal government, told at the last minute that their federally provided health plan no longer conforms to Obamacare and has to be canceled. Like they have a couple of days to get some more insurance. It's just starting to get crazy. So I thought we'd get back into it with some of these aspects of it. Patty Newman is with us. And Patty, you have a specific concern working in the medical industry all your adult life about these 50 state plans. Bill King is also with us. He is certified by the He's certified, all right. Certified. You're going to be certified after you get through doing this.
Yes, sir.
By the healthcare, the Covered California Insurance Exchange here in California, to try to help people to figure out what's the best plan for them or their employees or themselves individually or the families. And we'll get to that in a minute. But back to Patty, what is this 50-state multi-state plan? What does that mean?
Well, it's actually 30 states at the moment.
Okay.
Multi-state plans were set up by the federal government to supposedly have competition between the states. But it didn't really pan out to be that way.
Under Obamacare, you mean?
Under Obamacare,
okay.
The Office of Management and Personnel Management of the federal government is supposed to oversee these plans, and they're calling them multi-state plans. But the truth of it is that they are not multi-state. They are within the state. The only reason they're called multi-state is because this one federal office is managing them across different states around the country.
How many insurance companies are participating, though?
One.
Well, this doesn't make it very competitive, does it?
No. The whole
one company.
One. Blue Cross Blue Shield is the only one that got a contract in 2014. They're hoping that they'll have more companies participating and all 50 states covered. But the reason I'm here is because I think this is a really bad idea. You cannot create competition between states when you cannot see a provider on a network from a different state. You can only have it in your state. That means you can only see your doctor in that particular state. This is ridiculous. It's a joke. It's a lie, like all of the other lies that Obama has given us with this Obamacare.
Now, the Republicans have countered by saying there should be an ability for an insurance company that is registered in one state to compete in all of the states. That's
Absolutely.
Really one of their counters. Isn't that what this is trying to do?
It's not trying to do that, but it's trying to make people believe that that's what they're doing. They are competing amongst other plans that are Obamacare plans within that particular state. The problem is you have a state like New Hampshire, when there's one insurance company only for the whole exchange.
There's no competition at all. There's no competition at all.
So you come with this multi-state plan. Well, it happens to be the same insurance company. They offer the same plan.
No wonder these prices are going up. These premiums are going up, not down.
The premise of having the federal government infuse competition into a system that used to be a private healthcare system is ridiculous to begin with.
Bill King, this is in California now, to focus on California.
Multi-state plan, well, it happens to be the same insurance company. They offer the same plan.
No wonder these prices are going up. These premiums are going up, not down.
The premise of having the federal government infuse competition into a system that used to be a private healthcare system is ridiculous to begin with.
Bill King, this is in California now, to focus on California. We have our own insurance exchange here, Covered California, and it seems like the president's been moving the goalposts. He's been moving the deadlines for getting signed up. How has that affected California, if at all? I think California has its same deadline, right?
Well, Covered California did have the 23rd as a deadline, but Covered California, Peter Lee, is pretty much ignoring what the president wants to do. He wants his plan to be successful, so he's going to run it the way he thinks it should be run, not the way the president wants it run.
So we passed the deadline.
We have passed the deadline.
How do people get January 1 health insurance if they don't have it?
Well, there is a couple of ways. If they've started, then they get to have until basically tomorrow if they're working with an agent. So if you were to call me and we had talked last week, then I can get you on January 1st, effective, as I say, January 1st, but it would be Saturday at 6 o'clock, basically.
You've been doing this for over 40 years for health insurance with your clients. This has to be the most chaotic moment in the history of your career.
Almost, but yes, I'll give you that.
Because
it's been busy.
Over Christmas, you must be working day and night, because there are people, of course, wait till the last minute like they do on Christmas shopping, just to get things going for January, not realizing all the changes that have come up, not only for them individually, but you're also working with these employers and their employee plans, the group plans, right?
Yeah, the group plans, they're about to get hit.
Yeah.
The shock that they're going to go into is amazing. But most of them were put off until the December 1. They did an early renewal. They were put off till December 1. Come time, October or so.
Next year,
it's going to hit the fan.
and they're going to get notices before that, aren't they?
Well, the ones that renew earlier than that, but October is probably when they're going to get them.
Because not everybody was smart enough to say, okay, if I renew in December 1 of 2013, then I don't have to worry about this till a year later.
Yeah, we have one guy that couldn't move fast enough. He's paying 50% more January 1st than he did in December.
Phenomenal
50%.
stuff. Patty, this whole thing seems like a house of cards is falling apart.
It is.
Then what happens?
I have some crazy ideas.
Okay. We're up for crazy ideas. This whole thing has been a crazy idea.
At this point, we need to remember that the government gets its power from the consent of the governed, right?
Well, that was the old law. I don't know whether that applies now.
But we can still do that.
Yes.
Because we don't have to consent.
Right.
And this is my crazy
That's what elections
idea.
are about.
And not only elections. It's about your choices that you do with your life, with your profession. Physicians in California, and you've heard 70% of physicians were not participating with Obamacare. That is a form of expressing that we do not consent.
That's right.
I think physicians have, and I implore physicians to not participate with CMS in giving them their patients' medical information, the private information.
Because we're going to run out of time. But Bill King, have you found that out, that the doctors in the plans that you're talking about, that there's fewer doctors that are going to be, just like in Medicaid, there are fewer doctors taking Medicaid patients. We call it Medi-Cal in California. How about in these new plans coming up? I mean, doctors have got to be wondering, how am I going to get paid? What is this about?
Well, Blue Shield lost 40% of their doctors in this process. And I don't know for sure what Anthem lost, but it appears to be about half. So doctors have decided not to play in the game, but it's selectively. Like Scripps Clinic will take Blue Shield, UCSD and Sharp will take Anthem Blue Cross. So that it makes it more confusing, but it is they're selectively playing the game.
Well, we have more and more people, theoretically, supposed to be signing up, even though in California we have a net 800,000 that have lost their insurance rather than gained insurance. Where can people call you? Somebody's watching this going, oh my God, I'm in such chaos about this, I have no idea what to do. What's your phone number?
It's 800-442-5464.
All right, 800-442-KING.
Yeah.
And Patty, I hope you're going to continue on this because we need solutions. We need answers. This thing is messed up.
Patients can do the same. Patients can choose to go to providers that are not participating. They can choose to express their lack of consent.
Patty and Bill, thanks very much for being here. I appreciate it. We had that. Don't go away because we wanted to talk to our viewers through our Facebook page. It's the Roger Hedgecock Show. Ty Hines standing by when we asked the question, what would you do about the sea lion poop in the rocks at La Jolla, which is causing such a disruption? Ty, I know you have the answer to
this. This poop has been on everyone's minds in La Jolla ever since these sea lions